Hey guys, welcome back to Well. Today we're going to be diving into the intersection between wellness and the healthcare industry. And no better person to chat about this than Dr. Gloria Winters. She's the Chief Health Officer of the YMCA of America and has over 25 years experience as a physician. She's someone that I've seen speak on stages, she's become a friend, and she is just an absolute inspiration. She's got great insight after being at the table in Washington when decision making is happening. She's been in communities behind the scenes, and honestly, her metaphors just help me understand the whole landscape. I am so excited to have Dr. Gloria Winters here today with us. Thank you for being here.
Yeah, it's my pleasure. Thank you for having me.
Of course. I'm so excited to have your insight. I was really honored that you agreed to jump in and podcast with us because this is such an incredibly critical topic as we're looking at, honestly, the scary numbers we see right now when it comes to the health of our nation and the exciting fact that we have a lot of attention on the industry, the preventative wellness industry right now. And I thought no better person to talk to about it. So tell us a little bit about you, how you landed into medicine, your family, and really now that you've landed at YMCA, what you're doing on the wellness side of things. Give us a brief history of Dr. Gloria Winters.
Yeah, I would love to. Yeah, so I have been in healthcare now for 25 years. I reside in Colorado, lovely, gorgeous state for the listeners. Come visit. We love having our guests.
Yay.
And I've been, my background is actually, I have a doctorate in orthopedic physical therapy, I still do practice some for the last 25 years, treated
Wow.
patients full time, and then managed the business operations of 12 clinics across the Front Range in Colorado.
Oh my gosh.
And so did both simultaneously. And I love treating patients. I feel very blessed to be gifted at that, as well as then leading my practitioners in treating those patients as well. That was the easy part of the job. The hard part of the job was the healthcare, the actual healthcare business. So billing, reimbursement, CPT codes, all of that side of the house was always my pain point. And so over the years, I had begun to really look at how do I really impact the whole health of a patient. And as you know, from coming in for any care that you have for yourself or for your loved ones, when you come in, you get to really share one problem that you have. If you have three, you have to come back for another issue.
Yep.
What I began to see over the years was there was this really converging of the difficulty of actually providing good patient care. And so that means that you, my patient, I was thinking, ooh, I hope she doesn't notice that I'm not being able to spend as much time with her because of the regulations I was under. And then, gosh, I was not enjoying being a practitioner as much anymore. And that's across all specialties in healthcare as practitioners, I believe. I haven't really talked to any that haven't had that challenge.
Wow.
And so in that, I began to imagine, what does it look like to create whole person healthcare? And what we understand is that the CDC says that 20% of what affects your health is in clinical care, or as I call it, sick care. And 80% is in this behavioral, physical, and socioeconomic factors. That's the CDC says that. The World Health Organization defines health as a state of complete physical, mental, and social well-being, not merely in the absence of disease or infirmity. So as we understand that to be true, and of course, I saw that both clinically treating my patients and then operationally in the business sector of it, I began to think of what can I do to really create this? I had built new practices in YMCAs. One, it was good for my business because I understood it was where people live, work, and play, and the walking wounded are there. And so I could actually have a significant referral base within that. So it was good for business. But really what I saw was that the YMCA was so relationship centric, so community oriented, that I would actually make sure all of my practices were sending their patients to the YMCA for cancer survivorship, diabetes prevention program, personal training, post-rehab, senior coffee, swim lessons, you name it. And they would come back to me and they'd say, Gloria, your care of me was so great. But when you sent me to the Y, it changed my life. And that's fine if it's one story. But then when it becomes to be story after story after story, you start to think, I wonder what that's about. So all of that to say, like the DNA of the Y is this 80%. And so I began to talk to CEOs of healthcare systems and CEOs of even YMCAs to say, how do we do this whole person health component? And long story, probably long here, but really it's this connection between this 20% of sick care and this 80% of behavioral, physical, and socioeconomic factors. So that's why I actually exited out of managing those practices and treating patients full time, was to really start to create business models where we could connect the two together. And that's what I've been doing now at the YMCA of the USA as their chief health officer for the last 8.5 years.
Oh my gosh, what an incredible story. I mean, it hits home so much because the why has been a foundation of my life since, I moved to San Diego essentially at different inflection points. So I really started in the yoga world because of the why, and that's how I found my yoga community, and ultimately my teacher that I trained under did my teacher training. And there was something so special about the connection there. And it was not at all just about going in to get a workout. And then that evolved to having kids and them going to summer camps or playing at the little soccer, clinics they have there or whatnot. And it really is incredible how the YS establishes itself as a community hub. And also I think it's synonymous with access, which is just so incredible that it's held true to its mission. And I think that is unfortunately the reality of where we see a lot of I guess, gap in engagement oftentimes is in different socioeconomic groups. And I think the Y's done a great job of making sure that's not a problem.
Yeah, you're absolutely right about that. The DNA of the Y is there as we are for all, and we meet
Hmm.
people where they're at. So across all different spectrums, that is our daily goal, is to make sure that we engage someone no matter where they're at in their lifespan or in their socioeconomic status, in their ability to access. We really reach out to meet their needs at each different level. We're within 73% of any given community in the United States.
Oh, wow.
Not
So how
Yeah,
many locations?
2,600 locations across the country.
Oh my gosh, that's incredible. Wow. Well, I mean, cheers to YMCA. I'm so glad that you landed
Thanks.
where you did. And I guess on that, like when you think about some of the initiatives that you're working on right now, what are the big things standing out for you and for the Y at this point in time?
The largest issue that has been called out at government, state, and local level is this social isolation and loneliness call out,
Mm,
right? And so at any of those different levels, we can understand that it's a massive crisis. It's of pandemic proportions. It
mm,
was escalated, of course, by the pandemic,
right.
but it existed prior to that. So the research is really, really showing now how this is a crisis across all age spectrums. And so that's really something that we're looking at focusing on. If we go into the sick care sector of the world and look at the disease prevalence and the cost of care for mental and behavioral health, it's the highest in all different
Mm.
sections. And so the question is how do we come together to help solve for that? And how do we know we're actually solving for that?
Yeah. I mean, it's something that we talk about all the time because most of the clients we work with at Walla are in boutique fitness and their word community is kind of thrown around all the time. That is what the ideal situation is. You've built something that you build it and they come, and people want to spend time with the people they meet there, and it becomes a third space of sorts. And
Mhm.
I know so many people in this industry are passionate about it and see the impact it can have on happiness and overall health. You mentioned wellness and healthcare and kind of this 80-20% situation. And I think to all of us that exist in the fitness industry, it feels like wellness and healthcare are such obvious siblings. Wellness should be the one who does most of the work that upholds the rest of the system, but it feels flipped. I laugh. I say they should be siblings, but they feel like estranged cousins a lot of the time because in our current system and regulatory environment, it feels very challenging to prove that wellness actually has an impact or feel like that it's being respected. So why has it been so hard to work together towards this common goal of a more healthy country?
Man, that is such a good question. It's pervasive. Everybody's asking that, right?
Hmm.
I think one of the things that first comes to mind is a story that I often tell. It's a parable that exists in the healthcare community, public health community. And so maybe I'll just even share that as because it really, for me, hits home as to the roles that we play and how we can actually continue to understand, one, why there's such a discrepancy between the two in our different spaces, and then how we actually bridge that gap together. So I'll just tell the story. So just hang with me here.
Yeah.
So imagine that you and your friends decide to go on a hike. And I know you're in San Diego, and there's actually some good hiking there. There's even better hiking in Colorado. Sorry, California. But imagine that you're one of these three friends and you decide to go for a hike, and it's a beautiful summer day and the leaves are all out on the trees and the flowers are out. And as you hike, you come upon a river and you hear the water as it rushes past to cascade to a waterfall below. And then suddenly you hear cries of a child in need of rescue. And so then you realize it's not just one child, it's many children crying out for rescue. And so you do what anyone would do, and you jump in the river to save the children. And so the first friend says, I'm going to go to the edge of the waterfall and save as many children as I can from going over. And the second friend says, I'm going to build a raft and get as many children onto the raft as I can and get them to safety. And so the two friends work tirelessly and they save many children. But unfortunately, like, some just slip past. There's just too many to save. Eventually, they look up from the work and realize the third friend is nowhere in sight. And then they realize she's swimming upstream, and they call out to her and say, where are you going? There's so many children here in need of rescue. And she calls out and says, I'm going upstream to find out who or what are throwing these children into the water, right?
Mm.
That's how the healthcare system works, meaning including the whole healthcare spectrum. So we have the first friend, and this is the specialist, right? This is the ICU nurse, the trauma surgeon, the ER doc. This is the one that you need when you're in dire straits to rescue you from going over the
Right.
waterfall bridge. Then you have the second friend. This is the raft builder. So this is the primary care clinician team. This is the one we visit for our primary checkups, to manage our medications, right? Get our shots when we need them. They're there to make sure that you get to safety and that you don't get into trouble and need that specialist. And while both of these two are vital and necessary, what we're missing is that third friend, the one who goes upstream to the source of the problem to look for the solution. And so that's where I say we in the health and wellness and prevention world come into place. We're the ones that go upstream to actually look for a solution before you get to that downstream sick care. And so that's where I
Right.
call myself an upstreamist. And
I
so
love it.
we're really in this health, wellness, and prevention world rather than the sick care world. Now, will the sick care world ever go away? No, it won't. There's, sickness happens. So that part will always remain. What we need to do is be very, very intentional about going upstream and looking for a solution. And so that's where we live in this space. And we need to be very, very particular about creating business models, solutions in order to do that. We've been doing it for eons and eons at the YMCA. We're 175 years old next year, but actually, have we proven it out that that's actually addressing this health and wellness and prevention as much as we intuitively eventually know it has? So that's what I would actually challenge
Right.
us to do. Is the division is there because we spend $4.9 trillion on sick care every year.
Oof.
That's 17.5% of our national GDP, right? 86% of those costs are spent on chronic conditions. So folks, like, that cost is not going to necessarily go away. It's actually, what will we do to improve the health and wellness and prevention up here so it doesn't get worse?
Right. Right. Gosh, I mean, just the point about how many people the YMCA has served and how can we prove that this is actually making an impact. I think the blessing in disguise is that we're all in this era of data and we're really, really focused on how can we prove and draw attention and frankly, governmental attention. And I know we spoke briefly before. You've spent some time interacting now with some of the high-level administrators and people at the regulatory levels that are really going to be impacting some of this preventative work. Anything you've learned recently or that's been really insightful to see the direction that we're headed?
Yeah. Actually, as it happens, just this week, I had the wonderful opportunity of meeting with Dr. Oz and his team. They are, if you know, Dr. Oz is the new administrator for the Center for Medicare and Medicaid Services. And we as a country are celebrating our 60th anniversary of Medicare. And so he
Wow.
wanted to connect with us at the YMCA to meet folks in the YMCA of all ages. And so he came to one of our local YMCAs to do that. But we also had really generative discussion about what we're doing in this health and wellness and prevention and how they're really looking to solve for this in our nation now. Really, really encouraging, right? Regardless of where you sit, I would suspect the audience understands this need for health and wellness and prevention to be elevated to a place to make it a priority. And that was actually really what was said over and over was this priority to address health and wellness.
Yeah, I mean, it feels like such a bipartisan issue, right? Like when we're talking about actual health of human beings and some pretty obvious answers that I think we've had for a long time, we just haven't had, that whether it was like the lobbying power or the attention that we've deserved, it feels like it should be something that's a no-brainer. And I'm glad to hear that at least that outreach is happening with the Y.
Yeah, and whether it's CMS, CDC, right before this, I was on with the CDC, the Center for, everyone knows the CDC now.
CDC.
But what we're really trying to do is make these concerted efforts to do this. And I think even as a health and wellness industry, us coming together to really move that forward is essential. We need to do it as a team. Doing it one-on-one is really not going to address it, as you heard, with this massive sick care world of 86% of these costs being in chronic conditions. So it's a
Yeah.
really key, really kind of on the edge of the cliff time right now to do this together to make this happen.
Yeah. Yeah. Well, I mean, just thinking about Medicare, Medicaid, I mean, those are two very high risk populations, right? Especially when we think about their time they have to commit to health and wellness, their resources, financial resources that they have to commit to health and wellness and just ability, physical ability. So I know just we briefly touched on it at the beginning, but access and affordability is a major problem in the US. And I think about it after running a studio and working with so many small businesses. I mean, it's also really hard to make it as a small business owner, right? Like it's expensive to run a business in America today. So it almost feels like these two things are at odds. Like we all desperately want to provide services for people who don't have, $300 extra a month to throw at a boutique fitness membership. I mean, the Y has provided a great solution, but anything else you see as a solution out there that can kind of bridge this gap between affordability and access and the rising cost of providing these services.
Yeah. I wouldn't assume to know each person's business, right? And how they're running that
Mhm.
and what their particular challenges are. As the YMCA, we are a nonprofit and we are, as you heard me say, for all. So we will make sure that that person has access, whether they can financially afford it or not. We also help with things like transportation for access, right? Like
Mm,
the real needs that are out there. So there's a lot of things to consider in that 80% of behavioral socioeconomic factors that really help them to access what we're getting to. Also, the relationship centric component of
mm,
building that trust with someone. So those things can't be undervalued as your foundation. But then what I would come back to is if it's been a while since you've looked at your business model and you've just been running things par the course, it would probably be really good to go back to some brass tacks, right? Remember back in the days when you were in school, really looking at the explicit components of how to create a business. And I would say look at those again. If you look at two of my favorites, Clay Christensen and Alexander Osterwalder, they're two of my favorite business guys. Clay
yeah,
Christensen has passed away. Alexander Osterwalder has grabbed a lot of his stuff and run with it. But they talk a lot about what is the job to be done, right? Really
yeah.
re-looking at that. They talk about the 9 different building blocks of your business. And if you're missing one of those business building blocks, you're probably not going to be able to do what your goal is to do as successfully.
Mhm,
And they also talk about the different types of business models, let's say sustaining innovation, efficiency innovation, and then transformative innovation. All 3 are business models. Some you plug and chug, right? Like your sustaining and your
right.
efficiency innovation. Transformative innovation is something brand new. So most times we might be plugging and chugging with just a tiny bit of a different variance. That might end up being your sustaining and efficiency innovation. You actually need to be doing transformative innovation at the same time in order
Mm,
actually to keep your business growing as you want it to. And when I say growing, it's both in the profit section, right, of revenue section, or and the ability to meet the needs of those folks that you're trying to help achieve those goals. So those are some really key pieces I would go back to.
Yeah, that's a great point. I mean, I think so much of our energy and effort are, I mean, I think about all the different fitness concepts that are constantly coming out there. There's a new kind of trend all the time, and the vast majority of it is all focused on what's the physical change we're doing, we're helping this person achieve. And in reality, what we're looking at right now is a consumer that has drastically changed. Their needs have drastically changed, right? Loneliness and isolation might be much more important to solve than, getting a six pack. I mean, obviously that's not the goal for everybody, but I think reevaluating your consumer at this point in time and the problems we have as citizens in a country that are, hyper stressed, that are often lonely, that are dealing with childcare challenges, or, there's so many different aspects to put barriers in front of access and problems that we're trying to solve. So that's a really good point, thinking about that transformative piece, and maybe the transformation you were trying to innovate around, or the problem you were trying to solve 10 years ago when you started your business isn't quite as important anymore. There's another problem or something else that needs to be transformed today.
Right. Or if you're inserting a new trend or your consumer is actually looking different, that might actually change some of those other building blocks of your business model. And you're actually keeping all the rest the same, when you ought to actually go back and look and see if you need to change the channel or the key activity or the key partner. So looking at all those pieces, maybe they stay the same, maybe they don't. And that actually may be the thing that moves you into a place of what you consider to be success in your business.
Yeah, I love that. Great point. So obviously I live in the technology world, and building software. I kind of live and breathe this every day. I have seen, after we actually met at an event, I'm often at some of these big industry events where there's a hyper focus on technology in the world of fitness and wellness now. Do you see, whether it's wearables or tremendous access to the health data we have today, helping or potentially hurting this cause of bringing wellness and healthcare together? And the main reason I bring it up is I remember at one event, a doctor, a physician sitting on stage saying, listen, as much as all of this data is fantastic, and I love how our population feels a little bit more excited and maybe engaged with their personal health data, it's also frustrating because they come in and say, oh my God, my, HRV on my Oura Ring has been up so much, or I haven't slept well in 2 months or whatever. And they don't have a lot of potentially accuracy or consistency in data. And so it's challenging for physicians to know what to do with it.
Yeah. Well, there's two sides of one coin, right?
Mm-hmm.
So I think you're always going to have both the positives and the negatives from any of this space. And at the same time, whether I think it's more positive or less positive, we're still moving in it, right? Technology is continuing to expand. I do actually think it's a good thing. That's a complicated question, though, of why is it good or why is it bad? What I would actually say more of is, how do we actually look in our crystal balls, make predictions, look at actually what's happening, because it is happening, period.
Yeah.
If we look at the technological expansions over the last even 5 years, 10 years, and you can speak to this way better than I can, but if we talk about the technology, data, and platforms being the foundation of a house, I always think of it as your plumbing and electrical. It informs how the house works. If my plumbing and electrical is not working well, or if it's super sophisticated, my house works better. Yay for that. My living room, my bedrooms, and the roof of my house, right? The thing that holds it together. So I actually kind of have a framework for this house. And technology and platforms is the foundation. And so if we look at that foundation as being, let's just call it for our listeners, like an inch wide right now, even in the expansion that happens, what happens in the next 5 years? What if it goes to 5 inches wide as a foundation?
Mm-hmm.
That's huge. And who is actually using the technology? It's the consumers. It's all of us. Right? So if I look at the technological advances, the expansion of that house over these next 5 years, that helps me to understand the interoperability and the consumer access to their health, as you just mentioned, even when they come in with maybe incorrect data, that data will merge actually to inform a highly multifaceted, highly personalized picture of that consumer's personal health data. Now, historically, who's owned that? the sick care system,
Exactly.
right?
Hospitals,
Yeah,
doctors.
and they wouldn't necessarily even talk to each other at the time. So there wasn't the interoperability that we have now within the sick care system, but also as consumers. So if I own that as a consumer and I can actually create my own highly personalized picture, that's going to inform my decisions. For example, if we look at these rapid advancements of telemedicine, AI, wearable devices, robotic surgery, graded digital platforms, like all of these components now, many of them can be done at home instead of going to the sick care system. Who wants to go to a hospital system?
Right.
Not even me, right? And it's complex. So if I can get my breast cancer screening at home, if my husband can get his prostate screening at home, we can send that back in. Now I actually own that data and I can make decisions based off of that. If I
Yeah.
use my mirror that tells me my blood pressure, my temperature, right? My toothbrush and my toilet giving me biometric data, like that's a lot of information that we're going to be holding to understand our current health. So I think that that's where I would take it to really inform what will happen, not whether, in this case, whether I really like it or don't like it.
Right.
So that gives us a prediction for the future of health. And what that tells me is that these big box healthcare systems will actually start going into more specialty components because you'll be getting a lot of those things at home. And so it won't go away, mind you. It'll just be in these specialty places. And we're better for that to live in a place that we trust and live, work, and play. So what I'm prepping for is actually having that being housed in places that we live, work, and play in the health and wellness and prevention world. Then
That's great.
just to finish, that roof of the house is that government, that advocacy, that, the fiduciary components that we have that actually govern that. So that's
Yeah.
a pretty thick statement, all said and done, but that's where I think we're headed.
Right. No, I love that visual. 2 questions. Well, first of all, tell me about the toilets because I don't know about biometric toilets. What? Give me more.
Right. Yeah. So, just do a little research of what's out there, but is not to all consumers right now, right?
Yeah,
So
yeah, of course.
your toilet and your toothbrushes could actually give you some biomarkers of your health because you think
Wow.
that it's going to gather some of your samples of what's actually
Right.
happening there and give you a readout of that. So, and I'm probably even speaking that, and there's probably even more things that I'm not aware of
Right.
that give you these biomarkers that will, in a fairly short amount of time, be accessible to the generalized public.
Right. Well, I'm about to dive into women's health a little bit more, but one of the things just talking about bringing healthcare to you, to where you live, work, and play. I'm in an online community with other female entrepreneurs, and one of the companies that I'm so excited about, I'm going to give a shout out now, is called Teal, and it's actually at-home pap smears. Freaking amazing. Like, how many more women will actually do that on a regular basis if they don't have to go into a doctor and have a miserable experience with a tool that was created like hundreds of years ago, right? So really, really amazing to see that being brought to us. And especially, I just, my brain wants to explode with all of the opportunities for boutique wellness and fitness businesses to partner and align with some of these brands that are bringing products to them to look at the overall health of the people walking through their doors.
Yeah. And I would, speaking of AI, just push in something to your, your Copilot AI and ask them, what are those biometric home tools that you can do right now? And there's actually a lot of startup technology companies that are doing this. They might have a telehealth arm, or they might actually be one of the companies that actually are just delivering these tests to folks and then processing them and giving them their information back.
Oh, man.
There's a whole world out there that's doing that. And then there's the whole world out there that's actually creating these as well. So
Right.
I think we're just on the cusp of it, but that's what we want to look towards, is that's going to take that foundation of the house and explode it. And again, it's exponential, right? We see these technology changes back in the day when the Fitbit was the first thing, and now everybody's got a wearable, and we'll be going to ubiquitous, always on, invisible things all throughout your house that are going to give you all this information. Now, what do we do with that? How do we consolidate that? Right? That's some question. But will that actually change the sick care model? It will. And I think we can help inform that if we're ahead of the game.
Yeah. Great point. I was laughing as you were giving like the house model or kind of metaphor, because I think there are certain things coming out, and whether it's with AI or certain data I don't know, data wearables that almost feel like the clap on, clap off lights when, like things that we don't necessarily think we need, but it sounds cool. So everybody's trying it, right? But some of those things end up because we are in this era of data, collecting important data. And so I just hope, and my prediction is that the actual explosion is going to be in that kind of plumbing and wiring situation that you were talking
Yep.
about, the interconnectedness of all of these data points and platforms and healthcare centers is going to be the key to that house functioning well.
Yep. I agree. That's
Yeah.
why we're on together.
Yeah, that, and we're both. So I will tell the audience we met at this. Gloria and I met at this event where we sat next to each other and ended up having this hysterical conversation about our teenagers and our kids and how we like lock down their technology because
That's true.
it is. Yeah, we both have teenagers and are like, how do we protect these children from the absolute insanity that they are stepping into? But
Yeah.
you're a master.
Which goes back to that question, whether it's good or bad. I mean, there's good and bad, right, of this coin. And
Right.
how do we navigate that? And how do we not stick our heads in the sand, but then lean
Right.
in and determine how to help even my 17, 18, and 19-year-old boys navigate this space because it's not going away, right?
Right.
So
Right.
it's
Teach them how to live successfully within it.
yep.
Okay, let's dive into women's health a little bit. So I actually was just reading this week that California passed some sort of initiative that's requiring more menopause training for physicians. There was some drastic stat about the lack of training on menopause care and understanding of the different symptoms and whatnot. It's great. There's such a spotlight on women's health right now. And I think actually because our fitness industry attracts something about group fitness, especially women tend to be much more attracted to group fitness environments. There are so many opportunities for education, for making women feel like they're not alone in their hormonal journeys, wherever that might be, whether it's childbearing, whether it's menopause, whatnot, perimenopause. So I'd love to hear from you. I mean, just give you your moment to be on your soapbox and how we can improve the status quo and what you like about what you're seeing right now in the conversation.
Yeah. Well, here's the deal, right? Menopause isn't new. Surprise. And as you mentioned, the understanding of menopause is going through a major transformation. So I think we can just say yay for that on the soapbox, right?
Mm-hmm.
Sometimes we try to force a thing, but here it is. So let's embrace it. It's undergoing a transformation both scientifically, socially, medically. And so this reframing helps to, and this is both, mind you, in menopause and perimenopause, is really this reshaping and reforming, but it's helping to normalize the experience of
Yeah.
aging and reduce the stigma. And whether it's the refinement and revival of hormone therapy, there's been up and downs of that component over the last couple decades, actually, whether it's the brain and heart health impact, emerging hormonal treatments, or it's just the holistic care models. That's actually kind of the different bullet points, if you will, of where I think it's headed into. So as, of course, a woman myself in these years, I have leaned into personally trying to understand where that's headed. But and I think it's all good. So I do love that they're starting to reframe it. Again, back to your group exercise fitness, where the women are the strong ones in this. We also know in the industry, women are the buying ones. They're the decision-making persons for their homes. And so it's probably, simply put, it's about time. But I think that the science that's coming out is now much more helpful and much more positive than it was
Right.
before about this being a reality. And it'll be interesting to see both categories, both us as women and then the men as well, lean into that to see how that's coalesces into. It's a it's a both and to have my husband understand this, and it wasn't something that his mom ever talked. He didn't have he doesn't have sisters, but any other females. So it's really interesting to align not just us talking about it,
Right.
but what role do men take in helping to assist us in that?
Yeah. I often think about how the why behind the moment now, like why, what did we do right to get this in the spotlight? Like, there are so many times where I'm like, God, we have these problems. And when something does get solved or when it does move in the right direction, what did we do? What was it 5 years ago, 10 years ago that really started moving this in the right direction? so we can learn from it, right? And it's crossed my mind multiple times that we're in this era now, like probably for the first time ever, where we have a lot of more college-educated women who are entering perimenopause and
Yeah.
menopause years for the first time, who are in leadership positions and in positions of power. So there is just much more of a megaphone and a voice behind it. And so I keep thinking about how much we can do as women who are now entering this phase of life and who have a megaphone. There's so much we can do together. So I often think about like, okay, what is my battle cry for our listeners or the call to action? And it's, we have a lot more power than we think. And especially as a collective of women who are kind of new in this world of, college educated and in leadership positions and in some ways more visible positions than a lot of men. So anyway, my thought.
It's not just about rote representation as women,
Mhm.
about being mature, consistently maturing people that are strong leaders that have a voice and make a difference each day in the work that we're doing. And that affects change,
Yep.
right? It has weight to it rather than only a cry out for pay attention to this issue.
Exactly. Yeah, you're right. The weight to it is what's important. Okay, so what are you excited about in this space? Is there anything that you're, hyper focused on? I know we've talked some about the technology, but anything else that you're watching closely?
In the health and wellness and prevention space? Well, yeah, I think we've covered quite a bit of what I'm passionate about because
Hmm.
I'm really looking at how we change the future of health. And that's a big, huge phrase, right? The
Yeah.
future of health. And when I say that, I mean truly this upstream component so that we can affect the downstream. Because I will always love treating my patients and there will always be people that need that care. But how do we truly change the future of health? And it takes this effort of looking at the technology, looking at the business, looking at the, if you will, that house diagram again to
Hmm.
understand where we're headed and then build the business in order to support that so that it's
Yeah.
not a throwing spaghetti against the wall and then it falls
Yeah.
away, right?
Yeah.
Yeah. So
Awesome.
one of my favorite quotes is by R.K. Buckminster Fuller. It's a mouthful.
All right.
Um, he did many, many things, but one of the things he said is you never change things by fighting the existing reality. To change something, build a new model that makes the existing model obsolete.
I love it.
And we oftentimes spend a lot of energy on the problem and the roadblock rather than building something new that makes the other roadblock obsolete. And so
Right.
that's what I get to do in my job, and it's super fun.
Awesome. It reminds me of the Henry Ford. If I would have asked them what they wanted, they would have said faster horses.
Right.
So that's totally aligned. Also, you're really brave to say that full name on a podcast. I would have stumbled over that. Oh gosh. Well, thank you so, so much for your time today. You're such a wealth of knowledge in this world and doing so much good for the health of our population and with the YMCA. So we are very grateful. And if there's anywhere you want to guide our listeners, is there anything that you'd like to leave them with, anywhere you'd like to share more information about the why or what you're doing?
I just say dream big, right? Dream
Yeah,
big and then have the vision, create the strategy, and then create the business model underneath it that supports it. So
I love it.
I think, we've seen very few people can change the world, and getting us together on this podcast and maybe some of these listeners, we can do that together.
Yeah, awesome. All right. Thanks so much. See you next
Thank
time,
you.
listeners.